What's up, guys? Dr. Meathead back again for a Meathead Minute. This week we're going to talk about obstructive sleep apnea, or OSA, which is a pretty important topic from a health standpoint in the strength community especially, but it's also pretty common in the non-athlete community as well. I see it quite a bit in my clinic. For those of you who don't know what OSA is, it is when there's an obstruction of the airway during sleep that causes you to stop breathing. Now, I don't think you have to be a pulmonologist to realize that this is probably not a good thing for your health in the short term or the long term. Obstructive sleep apnea can have a lot of consequences that include increasing your just general overall risk for death, high blood pressure, pulmonary hypertension, congestive heart failure, among other things, all of which you do not want to have if you want to have a long career in strength athletics or just a long life. So the other reason that it's important for strength athletes is that we in general are already at risk for these other diseases because of our increased size. Strength athletes are generally bigger than your average person. Many of us have BMIs over 30. So our risk for high blood pressure, heart disease, etc. tends to be higher than that of the average person. So it's important that we pay attention to the signs and symptoms of sleep apnea. Things to look for that may make you think that you're at risk for developing sleep apnea or already have it. So you might need some help from your significant other, partner, etc. from this. To start out, do you snore? Especially if you're a loud snorer, this may be a sign of sleep apnea. Does your partner ever notice you stop breathing in the middle of the night? Do you have a neck circumference over 16 inches? Do you have a BMI over 35? Are you currently being treated for high blood pressure? Are you over the age of 50? Are you male? All of these things are risk factors for sleep apnea. And if you have more than 3 or 4 of those ones that I just mentioned, you should probably get checked out by your doctor and possibly get a sleep study. It's very easy to manage once you get diagnosed with sleep apnea. I will leave that up to your personal medical professionals, but it's something that can be treated that, if untreated, can really affect you both as an athlete and for your long-term health. If you're really tired during the day, if you can't figure out why, you're waking up with headaches, you're a loud snorer, just go get yourself checked out. Especially for those of you that use anabolic androgenic steroids, testosterone replacement therapy, whatever you want to call it, that actually increases your risk of sleep apnea in addition to already increasing your risk for the other disease processes that were mentioned before. So don't sacrifice your long-term health for being big and jacked. Being big and jacked is awesome. Lifting heavy weights is awesome, obviously. But if you think you might be at risk for sleep apnea, please go get yourself checked out because it's something that's not worth missing. All right, I will see you guys next week.